The Navy Marine Corps Relief Society was founded in 1904 to provide financial support to widows and orphans of sailors and Marines. Our programs and services are delivered primarily by volunteers and are funded by donations. The Society does not receive any government funding. Because families were not eligible for military health care, in 1922 the Society hired its first registered nurse to provide in-home nursing assistance and guidance on caring for babies and children. Today, the Society's visiting nurses make in-home visits to active duty Marines and sailors, their dependents, widows and widowers, retirees, and combat-served veterans. The Navy Marine Corps Relief Society is the only nonprofit that provides in-home visits by registered nurses to service members.
Our clients include Navy and Marine Corps mothers and newborns, elderly retirees, widows and widowers, and combat-served Marines and sailors. Each of those groups has unique needs. Our visiting nurses assess the client's medical, educational, and emotional needs and provide resources to meet those needs. Often, our nurses encounter opportunities to screen and assist with mental health needs, and we take that responsibility very seriously. Today, we'd like to highlight that service and encourage active duty and retired sailors, Marines, and their families, as well as Navy and Marine Corps leaders, to call on us for assistance and support. Visiting a client in their home allows a unique opportunity for assessment and teaching. Often a home visit affords our nurses an opportunity to assess for postpartum depression in new mothers and to provide support and recommendations, and sometimes refer the client for professional care. Society nurses can make follow-up visits for as long as necessary to ensure that the mother is comfortable caring for her infant. Our traditional visiting nurses have assisted first-time moms whose husbands are deployed, single active duty mothers, and seasoned moms with newborns. They provide emotional support as mothers learn new skills, navigate the military medical system, and support families with infants who have significant medical needs. Our program helps Navy and Marine Corps families learn to manage when their infant comes home from the hospital, so the service member can return to duty knowing his or her family is safe and thriving. Our Combat Casualty Assistance, or CCA, visiting nurses provide support, medical information, and resources to active duty, retirees, and post-9/11 combat veterans. Our nurses tailor their support to each client's needs. Sometimes that means helping them navigate and gain access to military and civilian resources. They help combat-served Marines and sailors find local and community resources, as well as earned military benefits and resources before, during, and after they're in crisis. Suicide prevention is a crucial part of our visiting nurse program. A recent grant from a very generous donor made it possible for the Society's 52 visiting nurses to attend Applied Suicide Intervention Skills Training, or ASSIST, a suicide prevention training course. ASSIST training has improved our nurses' intervention skills and ability to screen for mental health needs as they visit their clients worldwide.
The Society's visiting nurses can help you and your family stay mission ready while on active duty and to live healthier lives in retirement. The Society is here 24/7 to help Navy and Marine Corps leaders, their active duty service members, and retirees. Referrals are simple and home visits are always free.